February is Heart Awareness Month, and it's a time for us to take care of our hearts. And joining me today from Dignity Health is cardiologist Dr. Rachel Bond to talk to us about how important it is of getting a checkup and getting checked out for this. Good morning, doctor. How are you?
Good morning. I'm doing well.
Well, we know everyone's going red on February 3rd, but I feel every day we should be going red and talking about heart, of course, heart health, which is so important. One reason is me. I know how important it is. I've had a procedure done to make sure that I stayed alive. But that's what you're all about too, making sure we stay alive. And the best way is preventing.
Absolutely. And why we even think about Wear Red Day is because that's the day that we raise awareness that heart disease is the leading cause of death for women, just like men. We know that it is, unfortunately, an equal opportunity killer. And when we think about heart disease, we know that it's the leading cause of death, but as you said, largely preventable. Ways to prevent it actually come from going to the clinician, making sure that we have our numbers checked. So those common numbers include blood pressure, our cholesterol, our blood sugar, our weight. We know that right now there is an epidemic of obesity or being overweight, and like any other chronic medical condition, like high blood pressure or high cholesterol, obesity is as well. And we have many treatments out there, but a large part of the treatment is lifestyle. So we recommend eating a very well-balanced diet that includes more green leafy vegetables, having a more colorful plate as an example, and then more importantly, exercise. So the recommendation is 30 minutes at least every single day if we could, but at a minimum 5 days a week. And that exercise, as I like to tell my patients, includes walking. So that really, hopefully, we shouldn't have any excuses. We know that sitting right now, unfortunately, is the new smoking when we think about it. Wow. And smoking is another risk factor for cardiovascular disease. And we know that younger and younger people are unfortunately having higher rates of cigarette use. And if we remove all of those possible risk factors, we absolutely can lower the chances of having a cardiovascular event.
Yeah. Another thing, too, that's very important, and that is women get checked out. We know that women are, as we said, one of the number one deaths from heart disease because they don't go and take care of themselves. They take care of everybody else in the family. They'll take care of the husband who actually has had a heart attack or heart disease. But they don't go and take care of themselves, and that's one thing. Take the time out because then you can be there for your family, and that's a big important part there, isn't it?
Absolutely. I mean, you hit the nail on the donkey, as we like to say, in the sense that women always put themselves below those of their family members, their friends, or even sometimes their colleagues. And we know that a woman's health actually can dictate the health of all of those people, the family, their friends, as well as their colleagues. So self-care is such an important part of healthcare, and we really want to make sure that when it comes to women, they're going at least once a year for their wellness checkup, as we like to say. It's also important that they know their own individual risk factors because they're women. Yeah. Many of those risk factors occur during pregnancy if one chooses to have a child, so that could include having elevated blood pressure with pregnancy, diabetes with pregnancy, a condition called preeclampsia where your blood pressure becomes very high and that could impact your organs. And that could actually lead to not only issues during the pregnancy, but up to 2 decades after. So knowing if you've had any of these risks, talking to your clinician is really the easiest way for us to reduce any bad outcomes.
Yeah. One thing I also like about Dignity Health is they're about helping the minority community and bringing awareness to them because we know they are very at high risk because some of them don't get in to see doctors, they're afraid to, or whatever reasons, but Dignity Health is there for them and saying, please, that's one of the programs you guys have there to help out the minority communities.
Absolutely, and when we think about cardiovascular disease, even though it's an equal opportunity killer, it's disproportionately affecting communities of color, specifically Black women, even during the maternal health crisis, as we're talking about with heart disease being the leading cause of death or leading moms that are currently pregnant or just became new moms to unfortunately have poor outcomes. We know heart disease is leading that, and what we're seeing is that Black women have the highest rates, and that's across all sociodemographics. So as such, we at Dignity Health are taking it, really making it our responsibility, I should say, to get the messaging out there, to go to the clinician, get your numbers checked, but more importantly, work with those more disenfranchised communities to figure out how we can best navigate them through sometimes a very complex healthcare system.
Yeah, and I'm going to put this out there. I know we're finished up, but I know that I've been talking to doctors, and you're probably going to agree with me, And one thing right now, you really want a lot of people to learn CPR or refresh their CPR classes, because that's one way to help someone if they do go into cardiac arrest, especially mom or anybody, and they know what to do.
Absolutely, and one thing that I would like to acknowledge also is that when it comes to bystander CPR, meaning someone unfortunately has a cardiac arrest outside of a hospital, women are less likely to receive bystander CPR, and we see these disparities across all of cardiovascular disease. CPR is so life-saving, and if you don't feel comfortable performing it, I really implore you all to go to your nearest local organization, including your healthcare system, that could hopefully provide you with a course or a class so you can learn hands-only CPR, just putting your hands on the chest and making sure that we're doing immediate chest compressions could be so life-saving. We've seen it in the media, but we know that more importantly, it could be life-saving for both women just as much as men.
It is. Doctor, thank you very much for coming in and talking. Again, February is Heart Awareness Month. We have information right there on the screen on how you can get a hold of Dignity Health to find out more information. And of course, you can always go to aztv.com. So,
Thank you.
Doctor.
Thank you.